This is the story of a condition where perfectly sane older adults suddenly hear music, hymns, and entire choirs singing in rooms that are completely silent. It's called musical ear syndrome, and if you or someone you love has ever been afraid to admit hearing phantom songs that nobody else can hear, this video is going to bring you the relief you've been looking for. Musical ear syndrome is a real, documented, benign neurological condition, and it is not madness, dementia, or a sign that your mind is slipping away. This condition affects 16.2% of adults with hearing impairment, particularly those with presbycusis or age-related hearing loss. Today, we're going to walk through exactly what it is, why it happens, who it affects, and what you can actually do about it. Every fact you're about to hear comes straight from peer-reviewed medical research from institutions like the Cleveland Clinic and the work of some of the most respected neurologists in the world. So let's begin. What musical ear syndrome actually is? Musical ear syndrome, often shortened to MES, describes a condition in which people with hearing loss experience auditory hallucinations in the form of music, singing voices or choirs when no external sound is actually present. The music sounds convincingly real, as though it were drifting in from outside the head rather than echoing inside it. And people often scan the room searching for a radio or a neighbor before realizing no such source exists. The name itself dates back to 2004, when it was coined by Neil Bauman, the executive director of the Center for Hearing Loss Help. One honest note about Bauman: he is not a licensed physician or audiologist, and he describes himself as a hearing loss coping skills specialist who has lived with severe hereditary hearing loss since birth. Even so, he is universally credited with giving this condition a name and with bringing comfort to thousands of patients through his book, Phantom Voices, Ethereal Music, and Other Spooky Sounds. Here is the single most important thing to understand right from the start. In musical ear syndrome, the person retains what doctors call intact reality testing, which means they eventually recognize that the sounds are not real. No delusions appear, no paranoia takes hold, no accusing voices shout from the corners, and thinking stays perfectly organized. And that's exactly what separates this condition from hallucinations tied to schizophrenia or other serious psychiatric illnesses. How it differs from tinnitus, dementia, and mental illness. Let's clear up some common confusion, because many older adults who experience musical ear syndrome quietly worry that they have something far more serious going on. Start with tinnitus, because this is the most frequent mix-up. Tinnitus produces simple sounds like ringing, buzzing, or hissing, while musical ear syndrome produces complex sounds like full songs, melodies, and choral singing. Published in the journal NeuroImage in 2013, an EEG study by Vanistay, Song, and de Ritter showed that both conditions share some increased activity in the auditory cortex. But musical ear syndrome also lights up brain regions involved in language, music, and memory. The researchers proposed that tinnitus and musical ear syndrome exist on a continuum, which they described as the same but more. Next, consider schizophrenia, which is what most patients secretly fear when they first hear phantom music. The late neurologist Oliver Sacks explained the difference beautifully on NPR's Fresh Air in October of 2008 when he put it this way. It's completely different because, the voices are accusing, persecuting, humiliating, seductive, whatever. The voices seem to be addressed to one. They seem to be moral agencies. They make one acutely uncomfortable. And none of this is the case with a musical hallucination, which is like a sort of automatic replay of music one has heard in early life. Now, for the fear that weighs heaviest on families watching at home, musical ear syndrome is not dementia. People who experience this condition have normal cognitive function, they pass memory tests, and their thinking remains clear. Dr. Ronan Factora, a geriatrician at the Cleveland Clinic, has put it directly. Unfortunately, MES is frequently mistaken for dementia in older adults. But it's important to differentiate the disorder from those that impair cognitive functioning and lead to psychosis. Musical ear syndrome is widely considered the auditory version of Charles Bonnet syndrome, which is a well-known condition in which people with vision loss experience complex visual hallucinations while remaining completely lucid. The parallel runs so deep that some researchers refer to musical ear syndrome as auditory Charles Bonnet syndrome, and it has even been labeled Oliver Sacks syndrome in the medical literature. How common is this condition? Now let's talk numbers, because the research reveals that this condition is far more common than most people realize. Oliver Sacks estimated that at least 2% of people losing their hearing experience musical hallucinations, a figure he published in the journal Brain back in 2006. Neil Bauman's own estimate runs closer to 10% of people with hearing loss, though his figure rests on clinical correspondence rather than a controlled study. When researchers actually go looking for it, though, the numbers climb dramatically higher. A large prevalence study by Linson and colleagues, published in Psychological Medicine in 2019, discovered that 16.2% of adults with hearing impairment experienced auditory hallucinations. Published in the International Journal of Geriatric Psychiatry in 2002, a study by Cole and colleagues found that nearly 33% of elderly audiology clinic patients aged 65 and over reported auditory hallucinations. 1 in 3 cochlear implant patients experience musical ear syndrome, according to a 2021 study by Duchesne and colleagues in the European Annals of Otorhinolaryngology. So who is most affected? The research is remarkably consistent on this point. Musical ear syndrome overwhelmingly affects women and older adults, and the data line up across multiple major studies. A review by Evers and Elger, published in the Journal of the Neurological Sciences in 2004, analyzed 132 published cases and found that 70% were female. An even larger clinical series by Golden and Josephs, published in Brain in 2015, reviewed 393 subjects and reported that 65.4% were female, with the mean age at onset sitting in the late 50s to late 70s across these studies. Here is an interesting wrinkle worth paying attention to. Writing in the American Journal of Geriatric Psychiatry in 2012, researchers Tunisi and Olda Rickert found that when hearing loss severity is properly accounted for, age itself is not an independent risk factor. Put another way, aging is not what causes musical ear syndrome. Hearing loss is, and hearing loss simply happens to become more common as the years add up. Let's get to the part of this story that most people find genuinely fascinating, which is what the phantom music actually sounds like. The overwhelming majority of patients hear familiar tunes, and in the Evers and Elger review, 78% of them recognize the songs replaying in their heads. The specific types of music that show up are remarkably consistent across patients, across countries, and across decades of case reports. Hymns top the list by a wide margin. A landmark study by Nick Warner and Victor Aziz, published in the International Journal of Geriatric Psychiatry in 2005, examined 30 consecutive referrals in Wales, and 2/3 of those cases involved religious hymns. Abide With Me turned out to be the single most commonly reported tune. Christmas carols appear almost as often, with patients describing Rudolph the Red-Nosed Reindeer looping in their ears in the middle of July. Patriotic songs also surface repeatedly across the literature, and Oliver Sacks's own mother, at the age of 75, started hearing patriotic songs from the Boer War playing incessantly. Neil Bauman has described patients who hear the Star-Spangled Banner on the 4th of July, and many people experience childhood favorites, folk songs, and the voices of singers they adored when they were young, including one 78-year-old widow in Sri Lanka who heard the songs of a popular singer she had loved as a little girl. Then there are the choirs, which is where the condition earns its dramatic name. A 93-year-old woman seen at the Cleveland Clinic described hearing a men's choir singing in a cathedral, the kind of experience that can feel almost sacred and almost terrifying at the same time. Why familiar songs? Why music pulled specifically from childhood? The answer lies in how our brains store memories, and songs learned early in life are encoded deeply with strong emotional associations, which makes them unusually resistant to age-related decline. When hearing loss cuts off the flow of fresh sound, the brain reaches back into its most deeply stored musical memories and replays them like an old record. Speaking on NPR's Science Friday in 2007, Oliver Sacks described the mechanism in his own words. Quote, "It tends mostly to occur, not exclusively, mostly in people who are pretty deaf. And it's as if when their hearing parts of the brain aren't getting their usual input, their usual nourishment, then they dig down into memory and they activate themselves. So usually, these hallucinations are usually of popular songs, hymns, whatever one has heard in early life." End quote. Here is one of the strangest and most telling features of musical ear syndrome. The quieter your surroundings, the louder the phantom music becomes. Patients report that their hallucinations fade into the background when the television is on, when visitors fill the house, or when there's normal conversation in the room. But in the silence of night, alone in bed, that is precisely when the phantom choir becomes loudest and most persistent. One patient described lying in the quiet of his bed trying to sleep while a string of popular familiar songs refused to stop. This pattern makes perfect sense the moment you understand the neurology behind it, and that brings us to the big question nobody else is asking. What is actually happening inside the brain when silence turns into a symphony? The leading explanation is called the deafrontation hypothesis, and it works something like this. Your auditory cortex, which is the part of the brain that processes sound, expects to receive a constant stream of signals from your ears. When hearing loss cuts off or reduces that stream, the auditory cortex is left starved for input, but the brain does not simply fall silent in response. Instead, neurons in that region become hyperexcitable and start firing on their own, and to fill in the missing input, the brain pulls from its vast storehouse of musical memories and replays them so vividly that the person perceives them as real external sound. This is the exact same basic mechanism behind phantom limb pain. When a limb is amputated, the part of the brain that used to receive sensations from that limb does not shut down, it generates phantom sensations instead. With musical ear syndrome, the brain generates phantom music for the very same reason, filling in a gap left behind by missing sensory input. Oliver Sacks captured this beautifully in his 2007 book Musicophilia. Quote, "Given her deafness, the auditory part of the brain, deprived of its usual input, had started to generate a spontaneous activity of its own, and this took the form of musical hallucinations, mostly musical memories from her earlier life. The brain needed to stay incessantly active, and if it was not getting its usual stimulation, it would create its own stimulation in the form of hallucinations." End quote. Modern brain imaging has confirmed this picture in striking detail. Professor Tim Griffiths, a cognitive neurologist at Newcastle University, published a landmark paper in the journal Brain in the year 2000 that used PET imaging to show that musical hallucinations activate a widespread network of auditory association areas in the superior temporal gyrus, meaning the regions that turn simple sounds into complex music. A later study by Kumar, Sedley, Friston, and Griffiths, published in the journal Cortex in 2014, employed magnetoencephalography to track what actually happens during a hallucination in progress. They found increased activity in the region that processes melody, in motor and memory areas, and in regions that handle the emotional value of music. All of this evidence points in the same direction, which is that musical ear syndrome is not a psychiatric illness. It is the brain's natural response to sensory deprivation. The famous patients of Oliver Sacks. Oliver Sacks documented many cases of musical ear syndrome in his book Musicophilia, and a handful of his patients have become well known in the medical literature because their stories capture the experience so vividly. Consider Mrs. O.C., an 88-year-old woman who woke up one morning hearing Irish songs that seemed to come from everywhere and nowhere. She checked every radio in her home, and when she couldn't find the source, she actually theorized that her dental fillings were acting as a crystal radio. After her episodes eventually stopped, she told Sacks something touching. Quote, "I do miss the old songs. Now, with lots of them, I can't even recall them. It was like being given back a forgotten bit of my childhood again." End quote. Then there was Mrs. C., a deaf patient who confessed to Sacks that she was afraid she was going mad. Her words were exact and precise, and she managed to describe the hallucinations so clearly that she drew a sharp line between them and ordinary musical imagination, telling Sacks in quote, "They are completely unlike each other. They are as different as thinking of music and actually hearing it." End quote. These patients share something very important with everyone watching this video right now. They were not mad, they were not losing their minds, and their brains were simply responding to hearing loss in a predictable, well-understood way. Why so many people suffer in silence? Despite how common this condition has turned out to be, it remains tragically under-recognized, and the main reason is fear. Patients are terrified that if they tell anyone what they're hearing, they'll be labeled as crazy or diagnosed with dementia. Sacks himself observed this directly on NPR in 2008, and his words are worth hearing in full. Quote, "This could be very frightening to people. One associates hearing things, people wonder, are they going mad? Is their brain rotting? And in fact, there's been a great underreporting of musical hallucinations. People are afraid to mention them." End quote. Dr. Ronan Factora of the Cleveland Clinic echoed this exact concern in his own words, saying, quote, "Fearing judgment, patients are often reluctant to discuss their hallucinations, which can delay treatment and lead to feelings of isolation." End quote. Patients aren't the only ones in the dark because many doctors don't know about musical ear syndrome either. A 2016 paper by Kakmak and colleagues carried a title that says Everything, Frequently Seen but Rarely Diagnosed Musical Ear Syndrome. The Cleveland Clinic itself acknowledges that not every healthcare provider is familiar with the condition, and one of Sacks's own patients was bounced from her ear doctor, who said it wasn't her ears, to a psychiatrist, who said she wasn't mad, to a neurologist before anyone finally recognized what was actually happening to her. Neil Bauman has said that when patients first learn the name of their condition and discover that it's a recognized benign phenomenon, the response is immediate. Quote, "The first thing they tell me is that they read that and had enormous relief. Sometimes just that relief from the anxiety lets their musical ear syndrome fade away." End quote. That is one of the main reasons we made this video. If you are hearing phantom music, you deserve to know there is a name for what you are experiencing. You deserve to know it has been studied by serious neurologists. And most of all, you deserve to know that you are not alone. What can be done about it? What can actually help? The good news is that real, effective options exist, and most of them start with something beautifully simple. First-line treatment is education and reassurance, which sounds almost too easy to be medicine. Yet in one review of treatment effects, 11 patients showed significant improvement simply from being told the condition was benign and having it explained to them properly. The anxiety of not knowing what is happening turns out to be, for many people, worse than the hallucinations themselves. The second tool is hearing aids, and this one gets directly at the root cause. Because musical ear syndrome is driven by sensory deprivation, restoring auditory input often reduces or even eliminates the hallucinations entirely. Professor Tim Griffiths has put the point plainly. Quote, "Better hearing aids also appear to help suppress hallucinations, so we would advise people experiencing musical hallucinations to seek medical attention, if for nothing more than to ensure they have the best available hearing aids." End quote. And thanks to the FDA's August 2022 rule allowing over-the-counter hearing aids, for mild to moderate hearing loss, access to this treatment is easier than it has ever been. The third tool is sound enrichment, which works on the same logic from a different angle, filling the environment with pleasant background sound, whether that means a radio, a television, nature sounds, or quiet instrumental music, gives the brain the real input it needs to stop generating phantom music of its own. Beyond these main approaches, cognitive behavioral therapy can help patients manage distress, and increasing social interaction has been shown to reduce symptoms because loneliness tends to make them worse. Medications also enter the picture for some patients, with doctors sometimes prescribing acetylcholinesterase inhibitors like donepezil or rivastigmine or carbamazepine off-label. It's important to be honest about the limits of the evidence here, though. A comprehensive review published in Frontiers in Psychology in 2015 noted that all pharmacological treatment for idiopathic musical ear syndrome is off-label, and no randomized controlled trials exist for any musical ear syndrome treatment, which is why medication typically sits as a second-line option after hearing aids, sound enrichment, and reassurance have already been tried. A benign condition with a scary name. Let's bring everything together now. Musical ear syndrome is a real, documented, and well-understood neurological condition that most commonly affects older women with hearing loss. It causes people to hear familiar music, hymns, Christmas carols, patriotic songs, and choirs as vividly as if the sound were drifting in from a stereo in the next room. It causes people to hear familiar music, hymns, Christmas carols, patriotic songs, and choirs as vividly as if the sound were drifting in from a stereo in the next room. It is not madness, it is not dementia, and it is not a sign of psychosis. What it is the auditory equivalent of phantom limb pain, or of the visual hallucinations of Charles Bonnet syndrome, which means it is simply your brain, deprived of sound, doing what brains always do, which is to stay active by reaching back into its memories and replaying the songs it knows best. If this video has described what you or a loved one is experiencing, please share it, and please talk to a doctor, ideally one familiar with geriatric audiology or neurology. Ask specifically about musical ear syndrome by name, get your hearing checked, consider hearing aids, and fill quiet spaces with gentle sound. Above all, remember this one thing. You are not losing your mind. Your brain is simply singing to you in the silence. And now, at last, you understand why. Thank you for watching today. If this information helped you or someone you care about, please share it with a friend, a family member, or a caregiver who needs to hear it. Stay well, take good care of your hearing, and we'll see you in the next video.